we really need in thoracic surgery is a way to localize small lesions that we ordinarily wouldn't be able to see, to do it on the fly in the operating room in real time without all the logistical and risky challenges we have today. That's where CYTALUX comes in. We want to remove part of a lobe, take out the tumor, and make sure we have enough negative margin around it. In order to do that, you need to precisely localize where that tumor is.
It can be more difficult to find some of these softer, smaller tumors in the lung with minimally invasive types of procedures, meaning we are using now instruments as surrogates for our hands to try to feel these tumors.
CYTALUX is next-gen fluorescence imaging. It's not just lighting up blood vessels. You're actually molecularly targeting cancer cells, so you can see cancer cells in the operating room.
Tumors that express folate are going to pick up the dye based on this chemical or molecular interaction, and so there is no human element guessing where the dye should go. It's happening by itself. By having it a direct interaction between the tracer and the tumor, you get this accuracy of exactly where is the border of the tumor and exactly where is the tumor and are there more than one.
In general, localization, the faster we can find a tumor, the more accurately and confidently we can say that that's the tumor. That has a lot of value.
With CYTALUX, you're honing in on the tumor, and so it's really a leap forward in the accuracy of exactly where is the pathology and did you get it out. Logistics of using it was also really straightforward. We were able to have people receive the CYTALUX injection sometimes the evening before or the morning of surgery, and they tolerated well, it went smoothly, they show up in the operating room ready to go.
CYTALUX allows us to plan the administration of a safe medication without pain at a time convenient within 24 hours before surgery, and then bring them to the operating room without a needle hanging out of their chest or without having to undergo additional procedures.
Technologies like this can help avoid that larger incision, which does have impact on the patient short term. We know that smaller incisions, more minimally invasive surgery, allows patients to recover faster, get back to their normal lives faster, get out of the hospital faster, have less complications, and less pain.
You might find other disease while you're there, more than one nodule, and then you can address that and treat it all at once.
Finding these lesions when they're a small size and early stage without lymph node involvement, we're able to do more resections, preserving as much lung as possible.
If CYTALUX can help us to determine that I can do a more lung-sparing operation versus a more extensive operation, I think that has benefit.
To me, it's just a no-brainer. It's obvious how much it helps and smooths the process of nodule localization, smooths the process of scheduling, and makes us better at our job.
One of the patients where we used the technology had a tumor in the upper lobe of the right side. We found it easily with CYTALUX. We plan to do the resection of that tumor. During the operation, towards the end, when we were looking with the CYTALUX, I found an additional very tiny lesion in another lobe that ordinarily I would have completely discounted had it not been for the technology. It looked like a small piece of scar on the outside surface of the lung, but it did light up with CYTALUX, so I removed it. Sure enough, the pathologist says it was another focus of cancer. I absolutely would have left that behind had I not used the technology.